Mental illnesses are a lot more common than you think. According to the National Alliance on Mental Illness, 1 in 4 people are suffering from mental illnesses. These illnesses can range from small amounts of anxiety and depression to more severe cases like obsessive-compulsive disorder or post-traumatic stress disorder. Joining us in studio from the Wellness Center is Doug Fulp to talk more about mental health. Thank you so much for being here, Doug.
Thanks for having me.
So Doug, tell us, how big of an issue is mental health here on campus?
Well, mental health is actually something that everyone's dealing with. And one of our goals for the Wellness Center is to get every student, when they step on campus, to understand that they need to manage their mental health the same way that they manage their physical health, which there's a lot of ways we can act to prevent some of the things we don't want to happen, as well as develop tools that we can develop our resilience so that way, when faced with challenges, that we can bounce back.
So tell us, Doug, so what's the difference between a bad day and depression?
Having a bad day or maybe a bad experience, even something as severe as a bad breakup, maybe a relationship that you've had that's lasted a very long time, can be pretty detrimental to someone's mental health or their well-being, in that it's really hard to bounce back. But again, that has to do with that resilience piece. But it's a difference between having to manage those kind of situations and bounce back versus clinical depression, which is a diagnosis of where that person really isn't able to bounce back. It's not that they don't have the resilience, it's that they actually have a diagnosis, same as any medical condition, to where they are, without the help of medication and specific practices, are unable to get out of the depression.
So, winter quarter is often associated as, one of the worst quarters for mental health, but why do you think that is?
Well, for some people, they have been diagnosed with SAD, or seasonal affective disorder, which is very different from depression. Sometimes people think that they're just depressed for the winter season, but it's actually diagnosed completely separately, and then their idea of, or their body is reacting to not getting enough vitamin D from the sun, or just being able to process through that. And it's not only during winter, other people also suffer seasonal affective disorder from any different season for different reasons.
So what are some steps that students can take to minimize the winter blues?
The first thing they can do is try to get ahead of it, though right now we're kind of at the end of it. So definitely as students are preparing for finals, it's to identify how they best react to situations of stress, identify what has worked for them in the past, and really to eliminate those things that haven't worked in the past. Maybe that binge watching Netflix hasn't really been so helpful in them preparing for their studies, so know that they need to cut that out for right now while they prepare for finals. But also identify that maybe for some people it's making a list of things to do and checking them off one by one. For a lot of people, it's actually just seeing that progress or being able to check those things off that gives them the momentum that they need to be successful. And for some people, they just need to basically shut out all external noise that goes on. So for some people, it's going to the library and not being able to be distracted by the TV or their roommates or anything else might come up. For some people, they're able to focus through all the noise maybe in the circ and they study at a table. It's a little bit different for everybody. You just got to identify what works best for you as an individual.
So what types of services are provided or offered here at Central for mental health?
We definitely have a lot of resources, anywhere from our academic advisors to those of us in the Wellness Center who are willing to talk to anyone at any time, to our medical counselors in the Medical and Counseling Clinic. They're a great resource for us. Though they're often busy, there's only a handful of them to manage the 8,500 students that we have on our campus. So sometimes there's a little bit of a wait, but we have a lot of really great professionals on our campus, and I would identify that anyone that is underneath the umbrella of student success, or all those professionals that work in the offices like CLCE, CDSJ, we're all here really just to help students be successful. So a lot of times students don't know to seek out those resources there as well.
And so what would you tell a student who fears, seeking help?
I think that's the thing that I hear the most often when I ask someone, well, why haven't you talked to someone before? And they identify that they think that someone else needs that help a little bit more than they do. And students need to know that they need to take care of themselves first and foremost. And you can't take care of others unless you take care of yourself. And you can't really respond to things and be at 100% unless you're taking care of yourself and doing those preventative measures, which for many of us is finding out that what is that network or that resource that you can use and know it well ahead of time before you need to use it.
Okay. So what are some warning signs that we could see in someone who has mental illness?
If someone's having one of those things where they're not able to bounce back and it's more than just a bad day, it's really seeking out those resources, identifying the great resources we have in our campus as well as we have in our community as well. Comprehensive mental health is here in Ellensburg too, and great resource.
Okay. Thank you so much, Doug.
Thanks for having me.